Hi class, let's spend some time talking about the diseases of the nervous system. The diseases of the nervous system make up the vast majority of the chapter. And the first disease that we're going to focus on is a highlight disease of the chapter. It is meningitis. And since there are many different ways to trigger or cause meningitis, we're going to spend a lot of different time talking about meningitis. Generically speaking, meningitis is just an inflammation of the meninges. Recall that there are three different layers to the meninges. From superficial to deep, we have the dura mater, then we have the pia mater, and then we have, the arachnoid mater, and then we have the pia mater. Any syndrome or an anatomical syndrome or meningitis is an anatomical syndrome. It's associated with the inflammation of a structure. There are many different microorganisms that can cause this inflammation, and they're all grouped together because they have the same symptoms, inflammation of the meninges. There are serious forms of acute meningitis, and there are also less serious subacute forms of meningitis. Our serious forms, generally speaking, will be caused by bacteria that can enter the central nervous system through co-infection or through previous infections with respiratory viruses. Meningitis can also occur in neonates or newborn children, and is most often caused by microorganisms that are different from those that cause meningitis in older children and adults. So depending on the age range we're looking at, different pathogens could cause or trigger meningitis, depending on the age of the patient. To diagnose meningitis, we have to have the dreaded lumbar puncture, aka spinal tap, to collect some cerebral spinal fluid, and then we'll take that cerebral spinal fluid and we'll expose it to gram stains and/or culture it if we suspect meningitis. Then we'll treat with broad-spectrum antibiotics immediately. The signs and symptoms of meningitis can be fairly vague or broad, with headache, fever, nausea, photophobia, or you're scared of bright lights, skin rashes, increased number of so those are fairly generic symptoms. But two telltale symptoms of meningitis are a painful or stiff neck being paired with the headache, and if you do a spinal tap and find increased number of lymphocytes in the CSF, that's another big red flag. But generally speaking, the trigger symptom is that stiff neck with headache. One cause of meningitis is Neisseria meningitis. It's a gram-negative diplococci organism that lines up side by side. It's commonly known as meningococcus. This microorganism is associated with epidemic forms of meningitis and causes the most serious forms of acute meningitis. Within this species, Neisseria meningitidis, that is a tongue twister right there, there are 12 different subtypes or serotypes. Serotypes A, B, and C are the three most popular ones that cause most of our infections. The pathogens and virulence factors for this include bacteria entering the blood vessels very rapidly. These blood vessels will penetrate the meninges and allow for the symptoms to be produced by the bacteria as they are reproducing. As these bacteria reproduce, they release endotoxins into the generalized area of circulation. These endotoxins will stimulate white blood cells and cause damage to the blood vessels, in addition to cytokines, which can also cause damage to the blood vessels. As these blood vessels are destroyed from the inside out with the cytokines, we will have vascular collapse and hemorrhaging and petechiae on the trunk and appendages. So this form of meningitis will also have massive bruising or subdural bleeding or subdermal bleeding, aka bruising, and the patients as well. Every once in a while, the meningococcema becomes an overwhelming disease that has a very high mortality rate. This bacterium produces an immunoglobulin A protease and a capsule which encounters our body's natural defenses. So it's tough for us to fight off this bacterium by ourselves, which is one of the reasons why we'll supplement with medications. Some of the signs and symptoms that are specific to meningococcemia include the sudden onset of the disease and a fever that's higher than 40 degrees Celsius, sore throat, shock, coma, and generalized intravascular clotting can all be associated with it, cardiac failure, damage to the adrenal gland, and death within a few hours. Hopefully you don't get to that symptom at the end. Hopefully you'll recognize the disease before then. So obviously, Neisseria meningitidis is a very serious form of the disease. It's very acute and needs to be treated very quickly. For the transmission and epidemiology of this disease, we can find that the bacteria do not survive in the environment very well. Unlike other diseases like the smallpox virus, which can survive outside of a host for a very long time, this bacterium cannot. We usually are going to need to acquire this bacterium through very close contact with either the secretions or droplets of an infected person. Every now and again, we'll have some epidemic incidents in late winter or early spring. Some of these diseases, yes, do have a seasonal link to them. Our primary reservoir for this bacterium is human beings, and we'll harbor it in the nasopharynx region, so the upper back throat region. We'll have a carriage state that lasts for a few days to several months, and it's going to exist in between 3% to 30%, so about a third or less than a third of the adult population. And this carriage rate will exceed 50% in our institutional settings. Carriers that live in close quarters with other individuals that are susceptible are much more ready to transmit the disease. So if we think of a daycare family, situation of family, or a college dorm or military barracks, areas where we have lots of people crammed together that come in close contact with each other. Individuals that are at very high risk include young children or older children and young adults. So pretty much if you're of toddler age or your teenage years, you're at risk of high risk for developing this disease. To culture and diagnose this microorganism, we'll first start with the suspicion of bacterial meningitis. And even suspecting it constitutes a medical emergency. Why does even suspecting it constitute a medical emergency? Because we can have death within a few hours. And if the disease can kill you that quickly, you need to act super duper fast to help save the patient's life. Once you suspect the meningococcal meningitis, well, differential diagnoses are going to be done, and these are going to be done with care and accuracy. Meningococcal meningitis needs to be confirmed or ruled out because it can be rapidly fatal and kill off a patient quite quickly. Treatment is begun with that organism in mind because it's the one that kills off the patients the quickest, and it is assumed to be the pathogen until it can be ruled out. So we like to err on the side of caution and maximize our patient outcomes. To continue our culture and diagnosis, we'll take a spinal tap, we'll also take a blood sample, and we'll take a swab from the nasopharyngeal region. We'll use staining to observe for the characteristic diplococci of the bacterium. And there are also some rapid tests available. These rapid tests are specialized for detecting the capsular polysaccharides of this pathogen, Neisseria meningitidis, and cells that from the specimen, and allow us to skip the culturing step, which saves us at least 12 hours. There's a modified Thayer-Martin or chocolate agar that we use for these cultures. And no, chocolate agar does not have chocolate in it. It just looks chocolatey. I promise you, it's not good tasting. Presumptive identification of this genus is going to be obtained through a gram stain and oxidase testing, and further testing will be needed to confirm the diagnosis. Infection rates in most populations of Neisseria meningitidis is less than 1%, indicating that most individuals have natural immunity to this disease. If treated, this meningococcal disease has a mortality rate of 15%. So even if a patient does make it to the doctor, there's still a pretty high mortality rate. It's vital that the chemotherapy begins as soon as possible. Very high doses of penicillin G are given intravenously. Penicillin G struggles with making it across the blood-brain barrier, so high doses are given to maximize the rate of diffusion. We also need to treat the patients for toxic shock. Intravascular clotting also may be an issue, so blood thinners may be administered. If the individual is if a family member or another individual is in close contact with an infected patient, they should also receive prophylactic preventative treatments with rifampin and or tetracycline. So we have our first form of meningitis that we've talked about, which is from Neisseria meningitis, but there are several other pathogens that cause meningitis we have not talked about yet. Those include Streptococcus pneumoniae, Haemophilus influenzae, Listeria monocytogenes, Cryptococcus neoformans, Coccidioides immentis, and several viruses. So let's talk about those other pathogens that can cause meningitis. Let's first focus on Streptococcus pneumoniae. The causative agent is going to be a very small, gram-stained flattened coccus bacterium that appears end-to-end in pairs. So there's going to be a line of small spherical bacterium. These bacterium are typically going to reside in the nasopharynx. And one of the reasons why many of these bacteria that cause meningitis normally reside in the nasopharynx is because we'll have our olfactory bulbs, which are part of our nervous system, come in close contact with the nasopharynx cavity, or the nasopharynx region, and it's an easy point of access for microbes to get to our brain. The most frequently caused, Streptococcus pneumoniae is the most frequent cause of community-acquired meningitis. In approximately 25% of patients that have pneumococcal meningitis, they'll also have pneumococcal pneumonia as well. So these are accessory, or complementary, I should say, infections. These are typically going to be most likely in patients that have some kind of underlying susceptibility for this pathogen. The pathogenesis and virulence factors of Streptococcus pneumoniae include the fact that it has a polysaccharide capsule. This helps it to be protected against phagocytosis from the phagocytes of the immune system. Streptococcus pneumoniae also produces alpha-hemolysin and hydrogen peroxide. These alpha-hemolysin and hydrogen peroxide will damage the tissues of the central nervous system and is capable of inducing brain cell apoptosis. So this pathogen is capable of causing our brain tissue to self-destruct. It can penetrate our respiratory mucosa and gain access to the bloodstream and then enter the meninges. So that nasopharynx region is the common point of access. To prevent and treat infections of Streptococcus pneumoniae, we typically are not going to use penicillin. And this is because Streptococcus pneumoniae is often resistant to penicillin. Instead, we use ceftriaxone. Ceftriaxone is a drug used when possible, but because of drug susceptibilities, we must always test. So this is one of the situations where there is going to be a presumptive prescription given, and then a culture is going to be made. And then we are going to test to see which antibiotic is most appropriate based off of these specific strains' antibiotic resistance. It's recommended that a steroid is also given 20 minutes prior to antibiotic therapy, and this steroid can dampen the inflammatory responses to the cell wall components released by antibiotic treatment. As these Streptococcus pneumoniae bacterium are destroyed, the components of their cell walls will cause a dramatic immune response. So that to prevent that dramatic immune response, we'll give that steroid. There are two primary vaccines which are used right now to help prevent Streptococcus pneumoniae causing meningitis. One is Prevnar. It's a 7-valent vaccine, which is now currently recommended as part of the regular battery of childhood immunizations. And we also have Pregnovox 23. This is a 23-valent polysaccharide vaccine, and this is the version that is recommended for adults. Another pathogen that can cause meningitis is Haemophilus influenzae. This is going to be meningitis caused by, this is going to be a severe form of meningitis that can be caused by this Haemophilus influenzae. Prior to the vaccine for this pathogen in 1998, it was the most common cause of meningitis and death from meningitis. Now, because of the vaccine, it's much less common because our vaccine coverage is very effective. This bacterium is gram-positive and ranges in morphology from a coccobacilli to long filamented pallasides in formation. So this has amorphous morphology. It has multiple shapes that the cells can form. The cells do not produce capsules and have between 1 and 4 flagella. So while it may not necessarily have a capsule to resist phagocytosis, these bacterial cells will have flagella, which makes them much more motile. Some of the signs and symptoms of meningitis caused by Listeria monogenes include a mild or subclinical infection. So this is not going to be a particularly common one. It's going to occur in healthy adults with nonspecific symptoms like fever and diarrhea. If the patient is immunocompromised, then there is a very dramatic death rate associated with this infection. Pregnant women are especially susceptible because women that are pregnant are partially immunocompromised. This microbe can cross over the placental barrier or postnatally through the birth canal. Intrauterine infections may also result in a premature abortion and death of the child. Listeria monocytogenes is caused by a gram-positive bacterium. Its morphology can range from coccobacilli to filamentous and pallicides. These cells do not produce capsules as well and also will have between 1 to 4 flagella. In terms of its pathogenesis and virulence factors, it's not very fastidious, so it's not very picky on where it lives. Fastidious microorganisms have very specific environmental parameters that they need to stay alive. It's also resistant to cold, heat, salt, pH extremes, and bile. In other words, Listeria monocytogenes is a very tough to kill microorganism. It can grow inside of host cells and then move from an infected host cell to an adjacent healthy cell directly from cell to cell while evading the immune system. The reservoirs for this pathogen are in both the soil and the air. Animals and plants and food are secondary sources of infection. Generally speaking, most cases of listeriosis are associated with ingesting some kind of contaminated dairy product, poultry product, or meat product. This pathogen can be isolated in 10 to 15% of ground beef, 25 to 30% of chicken or poultry carcasses, and 5 to 10% of processed meats and cheeses. To culture this pathogen, we use a cold enrichment plan. So we'll take the specimen and hold it at 4 degrees Celsius and periodically plate it on media. This procedure can take 4 weeks, but this pathogen can grow at these cold temperatures, whereas most other pathogens will not be able to grow at these cold temperatures. So it will still be able to preferentially out-reproduce and out-compete the regular pathogens that are the mesophiles, as opposed to being a psychrophile. To confirm a diagnosis, we can use a rapid test kit with an ELISA. We can also use immunofluorescence or gene probe technology for direct testing of the dairy products. To prevent and treat an infection caused by Listeria monocytogenes, we're going to use antibiotics. This antibiotic therapy should be started as soon as we suspect that listeriosis is the cause of the meningitis. Our first choices for our antibiotics include ampicillin and trimethoprim-sulfamethoxazole. Oh, that's a mouthful. Yeah. Erythromycin can also be used. Prevention of this disease can be improved by adequate pasteurization temperatures and adequate cooking temperatures at home and refrigeration temperatures as well. So properly preparing the food in the kitchen and the avoidance of unpasteurized cheeses by pregnant women are also recommended to prevent infection by this pathogen. Our next pathogen that can cause meningitis is Cryptococcus neoformans. Cryptococcus neoformans, it causes a chronic form of meningitis that has a very gradual onset of symptoms. Other forms of meningitis will have very quick onset of symptoms. It can kill the patient in as few as a couple hours. This form of meningitis takes a much longer period of time. If the patient is immunocompromised or is an AIDS patient, the onset can be quite rapid and the disease much more acute. This sometimes can be classified as meningoencephalitis. So in addition to having inflammation of the meninges, there'll also be an inflammation of the brain itself. Headache is the most common symptom. The stiff neck can also happen along with the nausea, but just general headache and very mildly stiff neck are typically the complaints of the patients that are suffering from this. Our causative agents are going to be a fungus, and this fungal-based infection or myoses, has this particular strain of fungus is going to have a spherical or ovoid shape to it, and will have very small constricted buds that will be emitted from it, but also will have a large capsule to help prevent phagocytosis. The primary location or niche that we can find Cryptococcus neoformans in the wild is a bird population. So we have its presence in areas that have very high pigeon concentrations, or if we have high nitrogen environments from bird droppings. Anywhere we have lots of guano, there will be an increased concentration of this pathogen. We'll also find masses of dried out yeast cells that are scattered in the air or dust, and that can be an ecological nest for this fungi. And healthy humans are going to have a very strong resistance to this fungal infection. The highest rate of infection typically is going to occur in patients that have HIV/AIDS. It is frequently fatal and can be treated with steroids. If a diabetic or a cancer patient is also immunocompromised, that can further predispose, you know what I mean, can further predispose the patient to infection. There, now I said the word. Predispose. There we go. Cryptococcus neoformans can be treated with amphocytin B and fluconazole over a period of several weeks, and there is no prevention for this pathogen. It is very ubiquitous in nature. Up next, our next cause of meningitis is Coccidioides species. This is a genus of fungi. It's able at 25 degrees Celsius to form moist white-brown colonies and that have many branching, fuzzy-looking hyphae. These hyphae can fragment in thick-walled araconia, a special media that is needed for growing this in a laboratory setting. This media will be incubated at higher than body temperature, and at this temperature, the anthrospores will germinate into the parasitic phase of a small spherical cell called a spherule. There are two species in particular, Coccidioides immentis, which is responsible for the disease in the California San Joaquin Valley area, and C. posidil, which is more widely distributed in the United States, Southwest, Mexico, and South America. The true systemic fungal infection is going to have very high virulence. It starts out as a pulmonary infection, but will later disseminate throughout the body. Coccidioides of the meninges are a very serious manifestation. All people that inhale the arthrospores from this fungi are probably going to develop some degree of infection, but a wide number of us will have a genetic susceptibility that will give us a rise to this disease. The arthrospores are going to develop in spherules in the lungs, and depending on how immunocompromised we are or a genetic predisposition, these mild respiratory systems may develop into a disseminated disease that eventually makes its way to the meninges of the central nervous system, resulting in meningitis. This disease is going to occur most often in the southwest United States. There's approximately 100,000 cases a year. We'll also get it in northern Mexico and parts of Central and South America. Generally speaking, there are very concentrated reservoirs that occur in the San Joaquin Valley of California and Arizona. There was an outbreak as recently as 1994 that was traced to Northridge, California, and this was after an earthquake loosed clouds of dust into the air containing lots of spores, and the local winds then carried this spore-filled dust to local residential areas. We also have viral causes of meningitis. Aseptic meningitis occurs when no bacteria or fungi are found in the cerebral spinal fluid. Viruses are going to cause 4 out of 5 cases of meningitis. So when in doubt, assume viral infection, because 80% of the cases are caused by viruses. There may be a non-infectious cause, but that is the exception to the rule. The majority of viral meningitis cases occur in children, with 90% being caused by enteroviruses, or viruses of the digestive tract. HSV2 is a common cause of viral meningitis. Every once in a while, there'll be a different virus that can gain access to the nervous system, but HSV2 is the single most common form of viral meningitis. Generally speaking, viral meningitis is going to be much more mild than bacterial or fungal meningitis. It can be resolved in 1 week and has a mortality rate of less than 1%. Thank goodness. Especially considering how common it is. It's nice to hear that the mortality rate is not as high. The diagnosis of viral meningitis begins when we have a failure to find bacteria, fungi, or protozoa within the cerebral spinal fluid. Afterwards, it can be confirmed via viral cultures or specific antigen testings. In most cases, no treatment is needed for viral meningitis because it is so mild. It's subacute. Here we can see a cross mid-sagittal slice of the head, or at least the central nervous system, and we can see that in our nasal cavity and our oral pharynx, those are primary sites of entry for the pathogen to get to the meninges and cause meningitis. Neonatal meningitis, or meningitis of newborn infants, is almost always the result of an infection that goes from mom to baby, either in utero or as the baby's being born through the birth canal. As more and more premature babies are surviving, rates of neonatal meningitis are increasing. So as we look at the NICU, children in the NICU don't have as well established of immune systems yet, and they aren't able to fight off these diseases, and neonatal meningitis is currently on the rise, particularly in the NICU setting. This condition is favored in patients that have immature immune systems, so that are prematurely born. In most cases, it's going to be linked to Streptococcus agalactiae, E. coli, Escherichia coli, or Listeria monocytogenes. If this form of neonatal meningitis is caused by Streptococcus agalactiae, we'll find that it's a group B streptococci. It's capable of colonizing 10 to 30% of female genital tracts. So it's fairly common within the vaginal canal itself. To treat this form of Streptococcus that causes meningitis, we'll use penicillin G and sometimes supplement it with an aminoglycoside-based chemotherapeutic regimen. If a woman is considered high risk, they are going to be screened between 35 and 37 weeks of gestation. Both IV antibiotics can be given at the beginning of active labor and at the beginning of pre-labor to help reduce the risk of transmission from mom to baby. Erythromycin can also be administered in cases where the woman is allergic to penicillin. Neonatal meningitis can also be caused by E. coli. The K1 strain in particular of E. coli is the second most common cause of neonatal meningitis. This strain of meningitis occurs very often in premature babies and has a 20% mortality rate, even if it's aggressively treated with antibiotics. Those babies that generally do survive from having E. coli-based neonatal meningitis are going to have permanent brain damage. To transmit this disease, it's usually going to come from mom's birth canal to the baby. To treat the disease, we'll typically use ceftazidime or cefepime and a positive-negative gentamicin being administered via IV. Neonatal meningitis can also be caused by Cryptococcus sakazakii. This is formerly known as Enterobacter sakazakii. This pathogen is transmitted and has been from mom to baby, and has been implicated in outbreaks of neonatal and infant meningitis via powdered infant formula. Mortality rates of this particular kind of neonatal meningitis is as high as 40%. To prevent this disease, the FDA and CDC have advised hospitals to use ready-to-feed and concentrated liquid formulas as opposed to powdered formulas. They also recommend very careful hand washing and cleaning regimens for the feeding equipment, using fresh formula, and throwing away leftover infant formula. Here is a summary of neonatal and infant meningitis causes. We have our Streptococcus agalactiae, our E. coli, particularly strain K1, Listeria monocytogenes, and Cryptococcus sakazakii as our primary causes of neonatal meningitis. Wow, man, there are a lot of diseases that can cause meningitis. Which of the following microorganisms is not a cause of meningitis. It seems like we talked about a ton of them that potentially could cause meningitis. So you'll probably want to rewind the video, go back to those summary slides, and look at the list of microorganisms that do cause meningitis, and figure out which one from this list does not cause meningitis. You could also check your textbook or flip back in your PowerPoint slides. All right, pause it and get me an answer. 5, 4, 3, 2, 1. Okay, class. The answer is Clostridium tetani. Clostridium tetani does not cause meningitis. It causes tetanus. The other 4 bacteria, or pathogens I should say, listed here are all known causes of meningitis. If you have any questions for me about meningitis, please feel free to post them on the discussion board or shoot me an email.